We're going to take a look at diabetes mellitus and the gonads. So diabetes mellitus is a problem with hyperglycemia. So glucose is out of homeostasis, no longer in the normal range. And the hyperglycemia is caused by either not producing enough insulin or the cells are not responding to the insulin. There's two different types of diabetes mellitus. There's type 1 diabetes, where you're not producing enough insulin, and then type 2 diabetes, where the cells are not responding to insulin well, which is called insulin resistance, and then eventually you don't produce enough insulin as well. Let's take a look at the signs of diabetes. So cells can't use glucose for energy because either they're not producing enough insulin or the cells are not responding to the insulin. So cells are going to have to break down the fat stores and the protein stores instead and use that for energy. So the person's going to notice that they're losing a lot of weight. And we describe this as starvation in a sea of plenty, because they've got this hyperglycemia, they've got all this blood glucose, but their cells can't get to it. So even though they've got plenty of blood glucose, they can't use any of it. So they've got to start breaking down their fat and protein stores and use that as an energy source instead. So they do lose weight. And then we've got the 3 P's. So polyuria, poly meaning many. So the person's going to urinate a lot. So the reason that this happens is because they have glucosuria. So normally the kidneys will save all the glucose from the urine and put it back in the blood. But because the glucose is so high in the blood, the kidney can't save it all from the urine, and so some of it gets urinated out. And so that glucose that stays in the urine, the water will follow the glucose in the urine, and so you end up urinating larger volumes of urine. And so they describe it as melting down of flesh and limb into urine. So the person is going to be urinating a lot larger volumes. And then they also have polydipsia, which means increased drinking. So because they're urinating a lot more, they're going to have to drink more to keep up with all the water that they're losing through the urine. And then they also have polyphagia, which means that they're going to be eating more. And that's because their body is starving, because they can't get to that glucose that's in their blood. And so they're going to be hungry all the time and eating a lot, but yet they're going to be losing weight. So the name diabetes mellitus, how that came about, diabetes means to flow through, and that's referring to the large amounts of urine that they're producing. And mellitus means sweet, and that's talking about the glucosuria, so the glucose in the urine. So before they had any tests to do on the urine, they would actually taste the urine. And if it tasted sweet, they could taste the glucose in it, then they knew that you had diabetes mellitus. So that's where the word came from. We also see diabetic ketoacidosis in type 1 diabetics. We don't see this in type 2 diabetics. So what happens is in type 1 diabetics, because they're not producing hardly any insulin at all, they're going to be breaking down a lot of their fat. And when you break down a lot of fat, remember that that fat actually gets converted into ketones. So some of the fat, as you break it down, gets turned into ketones. And those ketones are acidic. And then that will change your blood pH and make it too acidic. And then your neurons in your brain do not work too well when your blood pH gets too acidic. And so they get depressed. And so that will actually, if it gets bad enough, will cause you to go into a coma. And that's a medical emergency because if the blood pH keeps getting more and more acidic and the neurons get more depressed, it can actually depress the breathing center in the brain, and then you actually stop breathing, and then that will kill you. So we only see the diabetic ketoacidosis in the type 1 diabetics that are not well regulated. So maybe they're not taking their insulin as they should, or maybe the dose isn't very well regulated, or maybe they are newly diagnosed, or maybe they haven't been diagnosed yet. So that's when we would see the ketoacidosis. Okay, so having these high glucose levels is really bad for your body because the hyperglycemia will actually damage tissues and blood vessels, and then breaking down all of that fat will actually lead to fat building up in the arteries as well. So all of that will lead to heart attacks and stroke. And the number one reason what kills diabetics would be heart attacks. We also see a lot of numbness from nerve damage because the blood vessels that supply the nerves, like in the feet, for example, they get damaged, and then the nerves don't work properly. So we get a lot of neuropathies in feet of diabetics, and then they can't feel their feet as well, or they're painful, and then they end up with sores that they don't realize that they have. And then because the circulation is bad, because of damage to the blood vessels, the wounds that they get don't heal very well, and they get infected, and then that might lead to limb amputation. So that's fairly common in diabetics that aren't well regulated. We can also see kidney failure and also vision loss, and again because of damage to the blood vessels. All right, let's take a look at type 1 diabetes, and this is where the person is not producing enough insulin. So they're barely producing any, and this most often appears in childhood. It's about 10% of the diabetes cases, and it's an autoimmune disease. So the immune system starts destroying the beta cells in the pancreas, and then if they're gone, they can't produce the insulin. As far as the cause, there seems to be a little bit of a genetic predisposition, and then the immune system might get set off because of a viral or bacterial infection, and then the immune system gets confused and then starts attacking the beta cells and destroying them. Treating type 1 diabetics, they have to have insulin injections daily. And then they also have to watch their diet, watching what type and amount of carbohydrates they eat. And then exercise is important as well, because exercise will decrease the hyperglycemia. Type 2 diabetes is much more common. It's about 90% of the diabetes cases. And what happens here is that the cells are not responding to insulin as well, so that's called insulin resistance. And so the pancreas starts producing more insulin to try to overcome that, and then eventually the pancreas starts to get a little bit worn out, and then it ends up not producing enough insulin. But type 2 diabetics do produce a lot more insulin than somebody with type 1 diabetes. Usually we see type 2 diabetes in older people, but it is increasing in kids. As far as cause, there is a much stronger genetic predisposition to type 2 diabetes. It does tend to run in families. And then it is associated with lifestyle. So, your diet, what you're eating. We tend to see this more in overweight people and people that are sedentary and not exercising. As far as treatment, losing weight will help a lot. And then people have to watch their diet as well. So watching the amount and type of carbohydrates they're eating. And then also exercising, which will decrease the hyperglycemia. Some type 2 diabetics, that isn't enough, and they will need some oral medications to help bring down their hyperglycemia. So there's a number of different medications out there, things like metformin, and there's a lot of other ones out there. And then there are a few type 2 diabetics that will need insulin injections as well. And I would know the difference between type 1 and type 2 diabetes. So that would be a good test question. So make sure you are familiar with what we talked about between these two. And then unfortunately, the prevalence of diabetes is really increasing. And there's a number of reasons for this. One is our lifestyle. So we are not exercising as much. We're not eating as well. We're probably eating more fast food than we used to, eating out more. And we're more overweight than we used to be. And also our population is aging. And we tend to see more type 2 diabetics in older people than we do in younger people. So that's also increasing our prevalence of diabetes as well. The last endocrine glands we're going to talk about are the testes and ovaries, the gonads. So they're going to be producing sex hormones, which are steroid hormones. They're hydrophobic and made from cholesterol, so that would be testosterone, estrogen, and progesterone. And then the placenta is actually going to produce one hormone, chorionic gonadotropin here, that is actually a protein hormone. And in men, the testes produce testosterone, and testosterone is needed for sperm development and also will help in the sex drive in men, and then also produces the secondary sex characteristics in men, so like the facial hair, the deeper voice, and bigger muscles. And in women, the ovaries will produce estrogen and progesterone. So estrogen is needed to help the eggs develop and will also help the uterine lining thicken, and also will produce all of these secondary sex characteristics for women. So for example, the mammary gland development. Progesterone will help prepare the uterus for a possible pregnancy. And if the woman does become pregnant, the placenta will develop, and the placenta is also an endocrine gland as well. It will secrete estrogen and progesterone, which will help maintain the pregnancy. And it also secretes the hormone chorionic gonadotropin. And chorionic gonadotropin is very similar to LH, and that will help keep the estrogen and progesterone levels high. And chorionic gonadotropin is actually what is tested for in pregnancy tests. So that's what they look for. And then these are just some of these secondary endocrine organs. You do not have to memorize these. We've already talked about some of these already. So remember, we talked about growth hormone going to the liver and then telling the liver to make the insulin-like growth factors, and then the insulin-like growth factors going to the body cells and telling them to grow or change their metabolism. And then we talked about the skin, liver, and kidneys making vitamin D3, which remember that will increase the calcium levels in your blood. You don't need to know the hormones for the GI tract. And then we're going to be talking about the ANP from the heart and the hormones from the kidneys, erythropoietin and renin. We're going to be talking about those later on in some different chapters, so don't really worry about those right now. And then table 6.1 from your book is really nice because it has all of the endocrine glands and their hormones they secrete and then what they're doing. So that would be really good to look over as well.